everybody.
Hello.
How is everybody tonight?
Good.
Good, good. I am sitting outside for this, so I really hope the light holds out. Otherwise, we'll do a lecture in the dark. It'll be great. Anybody have any quick questions before we get started? No, we're good. Okay. Tonight we're going to talk about inflammation, which is like the root of every modern disease. So it's kind of a big topic. In the challenge for this week, you've got an inflammation, kind of a quick check-in with yourself. It's not any sort of a medical tool, but you can go through and kind of get a feel for your level of resting inflammation. But inflammation is something that we all have. So, don't stress about it too much. Just work on it if you can. Do you think we should give people a couple of minutes? I ask this every time. Never mind. I'm not even going to ask today. We're just going to go to screen sharing. I'm taking the initiative. Okay. Hold on. Share screen. Okay. So let's start at the beginning. Okay. So inflammation, I mean, it's a reality of life, right? We live in a very inflamed world, and we have a very inflammatory lifestyle just generally. And I say we loosely, but modern Western society tends to have a very inflammatory lifestyle. So this week, we're going to talk about what inflammation really is, because it's another one of those things like antioxidants that everybody talks about, but people don't necessarily have a grasp on. Why inflammation and MTHFR are linked, how to assess your own inflammation, and then some simple steps you can take. And basically, this is why the MTHFR lifestyle matters so much. Inflammation lies at the root of literally every chronic disease we know of. Like I cannot think of one chronic disease that isn't just like a cold or flu or whatever, but like a long-term chronic disease that doesn't have inflammation at its core. So it's literally the modern epidemic. Even obesity is now considered an inflammatory disease. So inflammation is how your body responds to threat and damage. And it's supposed to respond to threat and damage, right? Like this is a good thing. It's something that we want, it's something that we want your body to be able to do effectively. It's just that we also want your body to be able to stop doing it effectively. And so anything that has the potential to do damage triggers an inflammatory response. So this could be like a little bug that you pick up somewhere, a pathogen, a virus. It could be an injury, right? Like, so little things you don't think of. If your gums are bleeding, if you get a hangnail, if you shave a little too close that day, right? It can be little things, but it can also be things like unaddressed toxins and free radicals. So if your free radical burden is tipped really out of control, that can also trigger inflammation. The words harken back to Latin, which, haven't brushed up on my Latin lately, but it means set afire, or translates loosely to set afire. Set afire is pretty appropriate. The hallmarks, of course, are pain, redness, swelling, heat, and loss of function. And as you can see in the picture there, it's linked to literally everything. So cancer is considered an inflammatory process. Arthritis, any diseases, Alzheimer's, and every other neurodegenerative disease. So like Parkinson's, ALS, all of those. Many of the bowel diseases, so inflammatory bowel disease is inflammatory. Obesity is considered an inflammatory disease now. Diabetes is considered an inflammatory disease. Autoimmunity is inflammatory. Depression is considered an inflammatory disease now. So yeah, it's kind of the gamut. Short-term inflammation is absolutely necessary and life-saving, right? Like without this, we would not survive little injuries, which is kind of sobering, but it's true. The problems arise when your body can't shut it down. Your body can't stop the process. So again, the list, right? Chronic inflammation is believed to underlie freaking everything. There's also a really weird circular relationship between depression and inflammation. So it's like inflammation makes depression worse, which worsens in turn the inflammation. And so that's kind of a weird cascade that people get stuck in too, because it's like a loop that you just can't get out of. So when we're looking at inflammation, it always turns into these really messy schematics. I've got this messy schematic and another messy schematic. Sorry, guys. But basically, what I want you to get out of this is that inflammation actually loops on itself, right? It can become sort of self-perpetuating. And so in the sort of pink shaded boxes, you see all of these things that can lead to this chronic inflammation, right? And so you've got whatever the immune challenge was at first, right? Whatever the stressor was. And then if you're bringing a stressor on top of a challenged immune system, then you get that delayed inflammatory response. You get that long-term immune response that turns into chronic. And part of that is all of these other boxes that are outlined in red, right? Like your gut microbiome has so much to do with freaking everything now that we know about it. Any predisposing factors. So adiposity is like the level of fat tissue to lean muscle mass. And so people who are obese actually do tend towards higher inflammation, because what we're finding out is fat cells create their own climate, right? Like they release their own hormones, but they also release inflammatory proteins. And so, so fat cells create kind of a different environment in your body. Major depressive disorder history, early life stress is a predisposing factor for chronic inflammation. And that could be for so many reasons, but I would assume it's because of genetic methylation. We don't know. And then genetic predisposition, right? Like some people do have genes that tend a little bit towards inflammation. MTHFR, when unbalanced, is one of those. When it's balanced, it's not. So that's good to remember. And so also sickness behaviors. Like the interesting thing about inflammation is that negative health behaviors promote inflammation, but inflammation also promotes negative health behaviors, right? So when your inflammation increases, we see also an increase in the tendency towards negative health behaviors, because it sets off this really unhealthy cascade of like food cravings or bad behaviors or negative self-care or poor mood and whatever. So this is like the I'm too sick to take care of myself feeling, right? Or I'm too sick, like I want comfort foods, I want comfort things, I don't want to do any of the work, I want to kind of like wallow in being sick, which is a place we've all been to, right? It's a totally familiar place. So I think that's, it's interesting to link that with chronic inflammation and to kind of see that pattern for what it is. So this was the caption from the last page, and let me see if I can, I'm not sure if I'll be able to. No, I'm not going to be able to. Let me back up. So I won't be able to read this, I think, because the pictures are over one side. You can read it yourself. But basically what it's talking about is the factors that increase the risk for that inflammatory over response, right? Like where you get into that cascade that just doesn't end. And so when you combine them with predisposing factors, then these immune challenges lead into that just chronic inflammation picture that then leads into the negative health behaviors that forms this circular kind of loop, right? And it gives the reference to the article if you want more information on that. Where am I? Where's my, okay, there we go. So the question is, what's actually happening when inflammation becomes chronic? Honestly, to me, it comes down to two really big things: your bucket and your backlog. And we'll talk more about that in a minute. But this is part of why I emphasize this so very much, because to me, bucket and backlog are like the thing. So inflammation is a whole body process. This is another messy schematic. I'm really sorry, but like this, if you Google inflammatory cascade, it'll give you the option for like 30 pictures that are equally frantic looking. Because the inflammatory cascade is just all over the place, right? And so in this particular picture, this was one of the ones that I thought was sort of a little bit more understandable. In this picture, you see at the very top, these are kind of the predisposing or the initiating factors, right? So like trauma or ischemia, which is like lack of blood flow to the area, or surgery or burns or viruses or whatever. And that triggers a response from immune cells. So that T cell and the macrophage, those are two biggest. And they are the ones that then start releasing this whole flood. And you can see like sprinkler effect there, this flood of chemokines and cytokines and inflammatory particles that are all triggering different reactions in the body. Okay, so that sprinkler goes down, it's like garden hose, all of these things go out, and then those things in turn affect all of your other cells, right? So literally every cell in your body gets involved in this. And we see, you know, like leukocytes are white blood cells, PMN or other immune cells, hepatocytes are your liver cells, CNS is your central nervous system, endothelial cells is linings of everything. So like skin, but also linings of your digestive tract, linings of all of those things. Target cells is freaking everything else, right? And then NK and T are other immune cells. So it just, like it truly is this cascade that's a whole body process. And remember that this cascade happens even if you get a paper cut, right? Like this is how your body responds to any perceived threat, big or small. And the response size and duration will vary, right? Like a paper cut will probably give you a little micro response, and then your body deals with it and it's done. But any injury or insult to your body does this, like the whole water hose of inflammation. And it's crazy looking, right? Like, yeah, if you're really bored and need a laugh, just Google inflammatory cascade. You'll get like so many of these pictures that are all just eye-popping and crazy. Okay, it's truly a whole body process. It starts with those immune cells, right? And then they send out all of these dozens, if not truly hundreds, of signaling molecules. I mean, different types, not just hundreds of molecules, but hundreds of different types, which cause all of the tissues they release to release their own signaling molecules, right? And so the point is to make sure that your whole body is ready to tackle whatever's happening, whatever this threat is, your whole body is ready to meet it. The problem happens when there's something always going on, right? If your body is always freaked out and thinks it's always under threat, well, then this whole mess is happening all the time, right? And that is a bad place to be. That is a really bad place to be. And when you're in that place, it's a problem of bucket or it's a problem of backlog. Those are the two reasons for being in that constant threat place. So there are some documented risk factors for inflammation becoming chronic. Age is one of them. So with increasing age, we have less capacity to deal with inflammation because there's more in the bucket. Let's face it, right? Like we've all faced more insults. And so that bucket is a little bit more full. Obesity is actually a quite big risk factor because fat tissue does secrete its own hormones and its own inflammatory proteins. So it's like it creates this microclimate that's ripe for inflammation. Diet is a huge one in the West. So diets rich in saturated fats, trans fats, refined sugars, processed foods, it leads to a higher production of those pro-inflammatory molecules. Smoking, obviously, not very many people do this anymore, but it's not so good for inflammation. Sex hormone balance. So there's some really interesting research that says that if your sex hormones are balanced, right? Like, so a balanced testosterone, balanced estrogen, it actually suppresses some of that inflammatory production. But if they're out of balance, then of course, inflammation gets higher. Stress, physical and emotional stress, increases all sorts of inflammatory proteins. And sleep disorders, right? Consistent sleep reduces inflammatory likelihood, and poor sleep obviously increases it. So how do you know if you're inflamed? We all have inflammation sometimes, but how do you know if you've got a problem, right? So there are symptoms. It's one of those things is if you have an associated condition, right? If you've already been diagnosed with something like cardiovascular disease, diabetes, autoimmune, arthritis, joint disease, allergies, COPD, or any kind of degenerative disease, right? Like so Alzheimer's or Parkinson's or something like that, we know you're inflamed. There's a disease process there already. Body pain, muscle pain, joint pain is a good indicator. Ongoing fatigue or sleep difficulties for no reason. And when I say ongoing, I mean, like prolonged. This is not a week of bad sleep. This is months of bad sleep. Depression, anxiety, and mood disorders can be an indicator. Ongoing GI issues like constipation, diarrhea, acid reflux, or frequent infections. So basically, if your health's not right, there's probably inflammation. There's only a few tests, which I find so remarkable. Like inflammation is behind so many things, and yet we don't have a lot of ways to test it effectively. So there's a couple of tests that are used regularly, but none of them actually give you any idea whether the inflammation is acute or chronic. So if you have like an infection, sure, you'll be inflamed because you've got an infection, right? But if you have chronic inflammation, there should be a marker for that. There's not. So there's a few tests that we have. ESR stands for erythrocyte sedimentation rate. And it basically measures, they put your little blood in a tube and they measure how quickly your red blood cells settle to the bottom. And the more quickly they settle and clump, the more inflamed you are. So less inflamed blood stays sort of mixed longer. More inflamed blood settles faster. It's like a measure of stickiness, right? Sticky blood is usually inflamed blood. C-reactive protein has become a big thing in the last, 15 years. It's made very, very rapidly if there's an inflammatory trigger. And so you can see this really quick rise in CRP. Like they started noticing it actually first in situations where there'd been a heart attack, right? So they'd say, okay, there's this weird marker. We're not sure what's going on, but something has happened. And it turns out it was a heart attack. There's also high sensitivity CRP, which is actually much more sensitive, as you would guess, and it detects low levels of inflammation that may lead towards atherosclerotic disease. And so that's more specific for the cardiovascular system and the heart. But thankfully, it's started to be sort of part of doctors' routine testing, especially if they suspect a patient is heading towards heart disease. And so that's really helpful. Fibrinogen is a clotting factor. It's factor 1, and it raises sharply in response to acute inflammation. So if there's, if you injure yourself or you get a virus or something like that, then fibrinogen goes wing. And that's because if you injure yourself, your body needs to be able to clot, right? So it pumps out all this fibrinogen to make sure that if you've got a big cut or a wound or something, that it will close and you won't just bleed out from a paper cut or whatever. But again, no really great markers of chronic inflammation. Now, there is some testing that they're starting to use in research. It's not used by doctors yet, right? Like nobody's doctor's office is looking at this, but in research, they're starting to find a link between the ratios of different white blood cells. So neutrophil to lymphocyte ratio, so the research, we don't even really know what's an optimal level. The average is around 1.65, and average people test between 0.78 and 3.53. Now, do we know what that means? Not really, but one thing you can do is compare your testing over time and see if your ratio is getting better or worse. So lower ratio is better. But we don't know how much lower. Like we don't have enough information about this to know what's ideal yet. But what we can do is compare, like, say, your own blood tests from 6 months ago to your own blood test now, and see if you're moving in a direction that's anti-inflammatory or pro-inflammatory. So it's, this is not a perfect system. This is the beginning. I don't have any faith in these numbers yet, right? Like we are not at the stage where you can say this is the number. But if you look at your own ratios over time, you can see the direction, like whether you're changing for the better or changing for the worse. Platelet to lymphocyte ratio is also kind of starting to be a thing in research, not a thing in clinical practice at all. But again, these are really commonly run tests. Like if your doctor does a CBC with differential, that's a complete blood count and it differentiates all the different cell types. And it's one of the most basic blood tests they will ever run. So a lot of times you have access to this data without a lot of fuss. It's easy to get. So both of these ratios are influenced by gender and also race. We don't really know how, right? So like, do not get attached to any number here. But to calculate your, say, neutrophil to lymphocyte ratio, just divide the number of neutrophils by the number of lymphocytes. It'll just be like a number divided by a number, and you're done. Same with platelets to lymphocytes. So platelets divided by lymphocytes, and you're done. That's your number. So not useful to look at the actual number, but useful to look at changes over time, maybe. Okay. Lowering inflammation is what most of us want to do. Myself, I want to lower inflammation. So basically, just follow the plan, right? Everything we've been talking about to date will help you to lower your inflammation. Eat better food, right? Decrease the saturated fats, the refined sugars, the trans fats, the processed foods. I think most of the people that, are at this point, right, where you're researching MTHFR, you've already done all of that. Like this is not the group that I'm worried about for, sitting down with a big old bag of trans fat. It's just not going to happen. Get some moderate exercise. Again, this is not a place where we want you to be a marathon runner. Like extreme exercise actually can boost inflammation. Moderate exercise lowers it. Sedentary lifestyle boosts it again. So it's like that happy medium, right? We're looking for happy mediums here. Sleep if you can. Gary, I'm so sorry. Every time I say something about sleep, I think of you. I'm sorry. We'll get you there. I promise. Each fiber. So you know how I am about fiber, but in addition to everything else it does, it also reduces two of the biggest signaling molecules for inflammation. That's interleukin-6 and tumor necrosis factor alpha. So IL-6, TNF-A. Eat your fruit and veggies, right? Anything you can do to boost those antioxidants and the polyphenols is also going to bring down your level of inflammation. More nuts and polyunsaturated vegetable oils. So anything with good omega-3s and those nice, loose, stringy fats, like Mediterranean diet. Mediterranean diet, hands down across the board of any diet that's been medically studied, gets the best results for everything, right? For cardiovascular health, for diabetes, for inflammation, for everything. Not necessarily for weight loss. Like it's not that type of diet so much. So people aren't like Mediterranean for, fitness. It's more Mediterranean for like living a long time and being healthy. Hey, pretty good. Add in turmeric. So turmeric is one of those herbs that you cannot go wrong, except turmeric is really valuable as a culinary herb. It's less valuable if you just take it as a powder or something like that. So turmeric does actually need to be warmed up in oil to be effective, because otherwise it is extremely fat soluble and you just don't absorb it, right? Like, so if you take a powdered turmeric in a capsule, you are absorbing almost none of that. If you open up put the turmeric in a little bit of coconut oil, warm it up so it's fragrant, mix it with whatever food you're eating, then you're getting good effects. And it's actually even more effective if you mix in a little black pepper with it. Like it activates it somehow. So this is what like the golden milk recipe or the golden milk thing that I was talking about. I love golden milk, but it's a great vehicle for turmeric because you do warm the turmeric and the other spices in a little bit of oil with a little bit of black pepper, right? Some cinnamon, some ginger, some nice yummy spices. And then warm that in whatever milk you drink, right? Dairy or dairy alternative milk. Lovely. It's lovely. And anti-inflammatory. Yay. So also the research is really interesting on mung beans. And this isn't something that we tend to cook with a lot culturally, but mung beans are very rich in flavonoids. They're anti-inflammatory, and they also 100 grams of mung beans has something like 150 grams of folate. Sorry, I can't see the number. It's behind a group of windows, but a fair, decent, dose of natural folate, which is great. So for us, lots of benefits there. They're sweeter than lentils, but you can use them in any recipe where you would use any other bean. Micronutrients. So, if you're taking a good multi, you're probably covered, but things like magnesium, antioxidants, vitamin E, vitamin D, zinc, selenium, they all help the anti-inflammatory process, and they help your body to come back from that inflamed place. Fish oils, again, they do everything, but they're strongly anti-inflammatory. Interestingly, sesame oil. So there's not a lot of food products that are studied for inflammation, but sesame oil is one that is. And apparently there's lignans in the sesame oil that reduce the synthesis of inflammatory markers. So there you go. So MTHFR is linked to heart disease, we think, because of the inflammation factor. We think. We don't really know. Homocysteine, which is an indicator of cardiac risk, is one piece, right? And homocysteine itself is pro-inflammatory. But also studies show that other inflammatory markers are higher in MTHFR folks compared to average. This could be why, for many people, changing their homocysteine levels doesn't change their cardiac outcomes. So there's a lot of research on MTHFR. Well, not a lot. There's more research than other areas of MTHFR in terms of homocysteine. And a lot of these people that have studied with high homocysteine, they lower their homocysteine using B vitamins, which is great, and the homocysteine comes down, but the cardiac risk doesn't change. Why? Right? That's what everybody wants to know, because if homocysteine is the risk factor, then that doesn't add up. I think it's because of the inflammation. That's my theory. So I think you have to lower the homocysteine and also address the inflammation for that risk to come down. It's hard to say. So what about backlog and bucket, right? Obviously, I think they're important, but why? Why do I think they're important? So let's talk backlog first. Your backlog is all of the toxins that your body has put into long-term storage, right? And long-term storage is fat cells, it's your bones. Any heavy metal toxins are stored in your bones or teeth, but all of the fat solubles are stored in your fat cells. So it puts them in long-term storage because it just doesn't have the resources to deal with them. Backlog is also unfinished processes, things that have gone badly, so things that have been done wrong, and badly healed damage. Every human has backlog. This is not just MTHFR, folks, but with MTHFR, we have the potential to have accumulated a little bit more backlog than average. So this is your body's to-do list. I don't know if anybody else here keeps a to-do list. I do. And the longer the to-do list gets, the more my stress and anxiety level ratchets up, right? Because it feels like it's piling up, it's stuff piling up. And so as this to-do list gets bigger, it's like putting its own burden of weight. I think, honestly, our bodies are pretty similar to that, right? Your body is amazing. Your body is freaking amazing. It is always constantly working to heal, right? Like this is literally a constant process of repairing and healing and maintenance. And so I think your body has that impetus to like metaphorically cross items off of the to-do list. And so the bigger the backlog gets, the greater that impetus becomes. There's also your bucket. And these are the things that you're doing right now, right? That are actually inflammatory. These are active processes. They haven't made it to the to-do list yet because they're literally currently happening. So basically, these are the places of threat, right? So viruses, bacteria, fungus, pathogens, anything that's going on there active. And that can be acute, like something new that you've encountered, or something chronic, right? So if you have something like cold sores, right? That's a herpes virus that's gone chronic. It's there all the time, right? That is a virus that your body has to always manage. Likewise, for a lot of people, chickenpox, right? So when it comes into shingles, that's chickenpox virus that got out of hand. And a lot of viruses that we encounter are actually that way, right? So Epstein-Barr is a very classic example, and Epstein-Barr goes chronic in some people and turns into, things like chronic fatigue and fibromyalgia. So lots of the viruses that we have had in our lifetime are still hanging around, and we're still having to do stuff with them. And most of the time we keep them in check, right? But occasionally they slip out. Also allergens and sensitivities causing any symptoms that you're having right now, right? If the air is filled with pollen, whether you're allergic or not, your body is dealing with that. It's doing something with it. If you're allergic, there's lots more happening. But even if you're not allergic, your body is doing stuff with it, right? If you're eating something, a food that you're sensitive to, your body has to process that. Your body has to do something with that. It creates an inflammatory cascade. Your body has to manage that. Injuries, scrapes, hangnails, like we don't put a lot of value on these things, these little like micro injuries that don't really bother us, but it's still something your body has to repair. It's something your body is doing. And also toxins, right? Like, so any toxins that are in your environment right now, something on the food you ate or the water you drank or the air you're breathing or whatever, that's stuff that your body's dealing with right now. That's in your bucket. And then also emotional stressors, right? So life is life. Stuff happens, and it can be stressful stuff, and that is in your bucket. So what do we do about it? So backlog, that's kind of what we're trying to actually address by following the plan long term, right? Balance your methylation and then stick with it as much as you're able. Avoid toxins, do gentle detox regularly, eat good food, hydrate, sleep, gentle exercise, right? And over time, this kind of clears out some of that backlog, clears out what we're dealing with. So the to-do list dwindles down to just like stuff that's going on now. And then the bucket, take as many big things as you can out of the bucket. If you don't do anything else for inflammation, think about eliminating food sensitivities. This is huge. Like, this is one of those things that just ratchets up inflammation exponentially. And if you can get that out of that bucket, it takes this giant chunk out. Mental, emotional, and physical stressors. And it's always really easy to say, oh, like, get rid of your stress. Yeah, it's a lot harder to do. Toxins in your home, that one's a lot easier. Junk food, processed food, refined food, as much as you can. And I am not asking anybody to be a Puritan, right? Like, I'm not looking for the uber clean, scary micro diet, right? Where you only eat 5 foods and they're the 5 healthiest foods you can think of. No. I'm not looking for that. But just be aware of it, right? And decrease where you can. I don't actually know what that next bullet point says. Work on balancing your, I'm guessing it's methylation. It's a good guess. And then look at your own red flags, right? If you have these symptoms left over, see what we can do to address those, because they might indicate an inflammation somewhere that we don't know about. The takeaway, inflammation is literally the base floor of everything. If you're looking to boost health, this is a good place to start. Inflammation starts with diet and lifestyle. And with MTHFR, that includes methylation, right? So those are the 3 pillars: diet, lifestyle, methylation for us. If you can kind of get those things under control, way better off. So this week's challenge, we do have an inflammation self-assessment. It's a quick tool. Like, this is not any sort of a scientifically validated thing. It's just a quick tool to kind of get a feel for where you are. And if you feel like an anti-inflammatory add-in is a good idea, then we can start that. An anti-inflammatory add-in can be just taking away something in your lifestyle that you know is inflammatory. That's a great step. So let me get out of this. I can see there's a lot going on in the chat, but I can't actually check it when I'm, oh, I don't want to annotate. I want to stop my screen share. I don't know how to get there. Sorry, guys, I can't see my mouse. So it's, oops, there we go. Okay. Did I do it? I'm not sure. Okay. Okay. So we whizzed through that pretty quick. What are you guys thinking? Who has questions?
Well, I have a question, but I saw a similar question come up in the chat about, so I've had the ESR and CRP done,
Okay.
and they're like low or basically nothing.
Perfect.
They're not elevated, yet I have all the symptoms of inflammation. So do those tests only measure acute things?
They measure acute and chronic, but they're not very good, honestly. Like, they're just not great measures. And I'm with you, like, my ESR and CRP always come back totally normal, right? Great. But I also have every freaking inflammatory symptom on the planet. So
then is it worthless to do those tests?
it's not worthless. And, you know, the crazy thing is I used to see clients all the time that would come in with these crazy numbers on their ESR and their CRP. And I'd think, like, how are you walking around right now? I don't get it, right? I feel like this and my numbers are normal. What do you feel like? You know, but so they do show up for some people. They don't show up for all people. So they're not worthless. They're just, you can't necessarily hang your hat on them, if that makes any sense.
Okay.
Yeah, it's what we got, but none of the testing for inflammation is perfect. Like, it's all so damned imperfect. And even the theoretical tests, like, it's so messy and complicated. None of it is great. So, you know.
And another testing question. So you mentioned Epstein-Barr,
Mhm.
and I had a physician tell me that, well, if you've had mono, your titer is going to show like that. She felt like it wasn't valuable to test now. What are your thoughts on that?
I think it is, because there's a big range between viral titers, like between people who have, say, chronic fatigue symptoms and people who don't. And that tells us something. And so if that viral titer gets really high, like Epstein-Barr or cytomegalovirus, both of those do tend to get really high for people who have chronic fatigue. And I think that's worth knowing, right? Like, it tells you that your immune system, A, is not working. It's not doing what it's supposed to be doing. It's not keeping those viruses under control. And B, that maybe you could bring some antivirals on board, right? Like, that might actually be helpful.
Okay, thanks.
Yeah, for sure. For sure. Let me go through the chat here, because there was a whole lot going on. Yeah. Lisa says shaving inflammation. I know, it's so goofy, right? Kevin, oh yeah, there was feedback in the beginning. I don't know what that was going on. Sorry. And then there's a big conversation about the feedback. Kiri says, I won't be able to stay for the whole call, business meeting, putting my questions in here. I have a bunch